Welcome to Radiologists, a podcast by University Medical Imaging Toronto, where we discuss the most interesting topics through the lens of Canada's largest medical imaging department. I'm your host, Satish Krishna. English is a quirky language. For example, somebody who runs is a runner. Somebody who sings is a singer. Who writes is a writer. So we have J.K. Rowling, we have J.R.R. Tolkien. By that logic, somebody who acts has to be an actor. So why is that there has not been a single female winner for the Academy Award for the Best Actor, but instead we have a Best Actress Award? This made a lot of sense, right? When I was looking into it, apparently it's something called generic masculinity or generic masculine forms. English language, some of the generic forms, like an actor, has been traditionally attributed to the masculine entity. And one classic example of that is fellow. Now, the fellow comes from an Old English word called phiolaga, which essentially means a partner or somebody who you undertake a joint enterprise or a joint adventure together. However, in ancient history, it has been primarily used in craftsmen and guild workers who are predominantly male, and it has become attributed to the male gender so much that fellow has become equivalent to a boy or a man. However, in medicine, in radiology, that's not how we use it. We still stick to the original intent, how it was supposed to be. Fellow was supposed to be a partner or an equal. And that's how we consider our fellows. And today, we have with us our fellow, Dr. Farah Cadour, who's a fellow in cardiothoracic imaging. We consider her so equal that we are also hiring her to join us as a staff from next year. Farah, it's great to have you here.
Thank you so much. I'm really pleased to be here. Thanks for inviting me.
All right, Farah. So primarily, we want to talk to you about fellowship. But I really need to take one step back because I saw from one of your bios that your dad was a radiologist.
That's right.
And now you ended up in radiology. How did that happen? Was it that your dad inspired you to be a radiologist? Because often it happens that when parents take a profession, the kids stop finding that very cool. So what happened in your case?
That's right. And actually, if I want to be honest, well, I knew that I've always wanted to be a doctor, a physician. I guess in the sense that how I was raised, like my parents, my mom always repeated me that it's always great. Like if you're on earth, you have like to help the other and do something that will just help the others. And I guess it's really, really the most rewarding job to be able to help the others. So it has always been something that I really wanted to be. Also, I have to say I wanted to be for all astronaut, but then I was like, okay, let's not dream about being an astronaut.
So you wanted to be an astronaut to help people. Something like that.
In a sense, like everything helps people. I think that every job helps people.
Fair enough. Inspires people.
Exactly. Inspires people, help people. But the fact that you really act, like directly can act on the health of people, it's really wonderful. And so in that sense, really, I've always wanted to be a doctor. Okay. But you're right in the fact that I've never wanted to be like a radiologist, maybe because of the fact that, you grow up saying, oh no, I'm never going to choose radiology as a specialty. And in the end, yeah, I chose radiology as a specialty. And to be honest, that's the best choice that I've ever made in my life because, I guess, and, maybe now I'm biased, but like objectively speaking, radiology is really one of the best specialty as you have like really like a broad view of like head to toe. If you want to get specialized in something, well, you get specialized in what you like. If you like to, directly, impact, patients, let's say impact patients' care. I mean, like intervene in patient, you can do like IR. So I loved also, I was hesitant between head and neck surgery and radiology. So I was like, okay, then let's do something that can combine everything. And radiology, it's really like, I guess the best field. It's like constantly evolving and, you can do whatever you want. You can be tired of radiology. And so every day, and the more I do radiology, the more I love it. So, and now I say, yeah, Dad, you were right. It's good. Radiology is good.
Yeah, I think that comes with wisdom. So when we are teens and when we are young, we are always rebellious. We are like,
That's
oh, Dad, you don't know what you're talking about.
I didn't want to say it, but I guess yes, that's what maybe like the rebel, in me saying, yeah,
Absolutely. And then wisdom is when you grow up and realize they were right all along.
yeah, yeah.
It's amazing you say that because we've had quite a lot of other guests who have shared a similar sentiment. Me personally, I never wanted to be a radiologist. It was just literal dumb luck that I ended up in radiology. And as you point out, it's the best thing that have ever happened to me. In a certain way, what you say makes a lot of sense. So if you're in medicine, you can either be a physician or a surgeon, right?
Yeah.
So physician, a lot of what they do is just patient handling, but then they take care of the diagnostic part of it. Surgeon, they take care of the therapy part of it, and then a significant patient handling.
Right.
But radiologist, we are in between, in which we take care of diagnosis and a bit of therapy with not that much patient handling, which is perfect place for a doctor to be in, but because that's exactly what we're trained to be, to diagnose and treat.
Yeah.
So that's amazing that you ended up in radiology. But now the question becomes, and this is something which I asked Minnie as well. The question I asked her was that there's this common joke that by the time you finish learning in medicine, your graduate, med school, residency, fellowship, it's time to retire. So the question is, why even do a fellowship? Because not everybody does a fellowship. After residency, you can go ahead into practice. So in my batch, there were 5 residents. Just 2 of us ended up doing residency. The rest of them just went into practice. So why did you decide to do a fellowship?
Yeah, so same as you say, like it's same. Well, I've been trained in France, and in France it's the same. Like it's not mandatory. Like fellowship is not mandatory. When you finish your residency, you can directly go to private practice if you want. But if you want to stay and have like a academic career and want like to pursue in university hospital and have an academic position, you have to have like this fellowship. But otherwise, it's not mandatory. And many of my friends, as you said, like just go on private practice and say, yeah, I don't want to do like because in France it's like 2 years of fellowship.
Okay.
It's not one. So they're like, I don't want to like. Yeah, as you say, like we've been studying our entire life, so now it's time to just enjoy. But to be honest, I see it in a way that you get really more comfortable in something, in a subspecialty that you love. And you get also like to meet other people, especially here. And that's why what I love in this program is that you have like people from all over the world, different horizons, different background. And so you meet so many great people, and you learn from the best. I guess we have to say, like you learn from people with like great experience. You get great exposure to great cases, and that's what really motivated me in doing a fellowship. But maybe also it's part of my nature and my personality that I really like university hospital, like research, being having to talk with my fellow corresponding clinicians, and having the medical student to teach, etc. So it was kind of natural for me to go through fellowship. And to be honest, here in Toronto, that's a great place. As I'm saying, that we felt welcome, and really, and we are grateful. You talked about Minnie. We are really grateful to have Minnie as fellowship director program, because she's really just wonderful. Yeah.
Yeah, that's amazing. Minnie as the captain of the ship is absolutely incredible.
Yeah.
It's interesting that you say that you were interested in working in university hospitals, and then you touch upon research, teaching students, having a diverse team around you, interacting with clinicians and being part of a team, and all of which, motivated you to do a fellowship. We'll touch upon that. But before that, I also noticed from your bio that you didn't come directly from France to here. You did sometime in Netherlands. You were in the US for a while, and now you're here. What's the story there?
Yeah, well, I guess I like to, I've always been open-minded in the sense that I like to see how elsewhere we work, how people are, like culturally speaking, also like humanly, it's a different experience, and knowing like how the other works, because I think it's counterproductive if you think that you are doing the right thing and there's no other way to do it. So it's always good to go and see outside how people do. So yeah, I did 1 year of fellowship in France. After that, I did.
So you did, after your residency in France, you did 1 year of a fellowship in France as well.
Yeah, exactly. The US part was during my my residency. I did 6 months in UCLA,
Okay.
so it was part of my residency. So I get like a sense of how it is in the US, and the Netherlands were through a grant that the Ezra Bracker grant that I've won to just get like 2 months of clinical fellowship in a special field that we want to get like more specialized in. So I went in Amsterdam to do this 2 months in cardiac imaging, and it was really like one of the greatest experience in my life. Met so many great people. So I was supervised with Dr. Speaker-Bauer. So if I don't know if she's gonna hear that, but yeah, I have to thank people when I think we have to be grateful to people that we love. So yeah, I met like so many great persons, and it just makes me, I guess, just more open-minded in the sense that, okay, they do it like that. So there's other way to do things. And so if you come back home, you just end up, having like a more open-minded and other perspective, and not just, really just focusing on the way that, it's used to be. And some people just say, yeah, but it's just the way it is. And you won't say, yeah, but maybe there's a way to do it differently. So.
Absolutely.
Yeah.
So you've done cardiac imaging in France in fellowship, and then you did cardiac and chest and cardiothoracic in Netherlands as well, and in US and in Toronto. So it's a very fair comparison at slightly different points of your life. And you point out that there is a different way of doing things.
Yeah.
Is there something which stands out, as in what are the fundamental differences in each of the places and how they approach it?
Well, I guess just in the US, it wasn't in cardiac imaging; it was neuroradiology. So it was,
okay.
yeah,
So
because it was part of my
okay.
rotation of neuroradiology. But I had like a sense of how things worked, and I used to go to like the resident teaching lectures, etc. But yeah, so I would say like the main difference maybe in France compared to the US or North America would be the fact that in France you really like learning through practice. You're like my first day. I want to share with you like funny story. Like first day of radiology, I was on the schedule. Okay, emergency CT in one of like the biggest hospital and trauma center in France. I was like going to the emergency with another older fellow, and I was like, oh yeah, I'm with you. I'm an emergency CT today. What should I do? And they're like, here's your workstation, here's the workflow. You have like the list of patients. You just report. I was like, okay, but what am I supposed to report? Like, I've never seen like a city before. And I guess you really learn the hard way, because you really like, like kind of responding to dogs. But in a sense, it makes you feel responsible really quickly, and you know like how to deal with the situation. And so in a sense, it's, I guess that's the main difference, like the way that. But then it depends, like not every hospital and university hospital are like that in France, but I guess it's one of the main difference. I would say practical learning instead of just learning through books. So I would say that's the main difference. And
that reminds me of my residency days, because the way where I was trained was very similar, in which you're just thrown into the deep end.
Yeah.
And if you're good enough, you can swim.
Exactly, you have to swim.
But then the problem is that often there is no supervision. And, as you point out, some people come out really good swimmers in adverse conditions.
Yeah.
And some don't. And it's always a problem.
Yeah.
And I think that way, Toronto is better, because Minnie was telling that there's a lot of resources available in Toronto to help you navigate that change from residency to fellowship. And I know that both abdomen and cardiothoracic are structured in a certain way in which there's a lot of independence given to fellows here. But at the end of the day, there is that safety net which we provide, in which it goes through the staff.
Right.
We look at it, we give you feedback. And I think that it's a better way to learn, because you always get that feedback instantaneously.
I agree. I agree that kind of the missing part that I missed when I was trained. That it's good because you get kind of comfortable, and you are more able, I guess, to deal with situation. Because even, for example, when I compared my training in France compared to other residents in other part of France, when they were like more supervised, I felt that we were really more, let's say we could handle more situation and like emerge. But that's always the thing that I missed. I was like, yeah, but I would love to have some feedback. And I agree that the thing here is that in the end of the day, you have this feedback from the staff, which is good because you know if you made any mistake, and you will learn from that. So and that's also one of the difference as fellow in France. When you're a fellow in France, you just like kind of have the title as fellow, but you sign out your report. So it's
Yeah, so you actually already jumped to that
kind
to the level of a
exactly.
staff.
You know, like you end up you finish your residency on Friday and you start your fellowship, so fellowship slash kind of stuff on Monday. And like by Monday, you know, you don't know what happened during the weekend, but it's like you've been kind of gifted by some miracle. Like on Monday, you have to know like everything, and like all the resident comes to you and say, "Oh yeah, you're the one like who has to have the answer." So, but it makes you also, you have to deal with the situation and just learn where to have the information, how to look for the information, and also you have to. I think you don't have like to really stress out beforehand about the situation, and just remind that you're not alone, and you can always like seek help if you need it, because in the end you have to think about the patient who you are dealing with. So yeah,
absolutely. Yeah, that's always the case, in which transitions are always challenging.
Yeah.
And the transition from residency to fellowship, as you point out in France, is very rough. Whereas here in Toronto, it's very, very gradual. Like fellows, although we consider them equals, we make sure to take care of them and give them the support and the feedback necessary so that they can become much better.
Yeah.
As I was talking to Minnie as well, like the idea for a fellowship here is that we have diamonds in the rough, we choose them, and we make sure that we polish them, and we make sure that they go out in the world and they're able to kind of shine out.
Yeah.
So in what ways do you think the fellowship here has benefited you? Because you have already done a fellowship in France as well.
Yeah.
And you point out that you were always interested in academics in terms of like research, teaching, and admin, leadership, and all this stuff. So I understand University of Toronto, there'll be a lot of cases, there'll be a lot of staff to discuss with. But then what other ways do you think that this place has made sure that you reach your goals?
Yeah. Well, the thing is, I guess first the structure, like the difference in structure between the fellowship that I did in France compared to here. In France, even if you do like it's supposed to be like cardiac and international, because you can mix the two. In France, you can have like the both part of the radiology. So even if you choose that, you end up doing like maybe two days out of 5 days in like your subspecialty, but the rest of the week you would deal with like emergency CT, oncology CT. So you also do like lots of stuff. Here it's really, and that's what I like, it's really like a place that you know that you're gonna do what you are seeking for. So you want to be specialized in cardiac imaging, thoracic imaging, then you have the 6 months. It's all chest biopsy and diagnostic chest, and then you know that you're gonna move 6 months of full cardiac imaging. You don't have like other things. So in that sense, you get really more comfortable because you see definitely more cases. And also the thing that I really love here is that there are so many different staff, and there are like everyone has their own background and their own expertise, and so you really learn different way from the other. And I guess it's one of the wealth of GDMI, the fact that everybody is unique, but also feel like part of the team as one team. It's really something that I really appreciated, and so that's, I guess that's the way where when you end up your fellowship here, you feel kind of comfortable in the sense that you have like diverse case, good recruitment, you have feedback, and you feel, even if maybe like on a daily basis you say, I don't know if I really progressed, in the end of the year when you say, oh yeah, definitely I'm more comfortable, I can deal with this situation. If I would start my fellowship and knowing that I have to deal with that, I would be just running away. But now you know that you can deal with that. So yeah, I guess that's the fact that you're really surrounded by great people and willing to share their knowledge, and that's something really valuable here.
Yeah, that's Absolutely true. Toronto is the melting pot of
Mm.
people from very diverse backgrounds, with very diverse lived experiences, and with very diverse expertise. But one thing which unites them all is their passion to do better, as well as to educate the next generation of radiologists. And we put in a lot of time and effort into that. And it's great that you've benefited from that and you find that very interesting and you find that very rewarding. But as a fellow, you're now in the midpoint between a resident and a staff, and you're joining us as a staff very soon. But currently, you're in the midpoint in which the staff are giving you feedback, and you do receive mentorship from the staff here, which I think as a part of a fellow is very important. But then at the same time, you are also training yourself to educate the residents. So it is kind of like a two-way sharing in which the staff are teaching you, but you're challenging the staff, but then the residents coming to you for help and you're training them. How do you navigate all of this, and how do you act as the mentor for the residents and a mentee of a staff at the same time?
Well, I think it's good. Well, having this feedback from your mentors, I've all you know, like through my medical school and residency, I was lucky enough to have like really great mentors during my residency, and I really want to thank them for that. Again, I don't know if they're gonna listen, but if they're gonna listen,
we'll send it to them.
yeah, like Hugo, Professor Daché, Professor Tuny, and Arturo, really like some people that you know that you're always gonna be grateful for, and I've always also seen like the kind of who were supposed to be mentors, but like didn't want to share their knowledge. So you see different type of mentors, and so you definitely know how you wanna be and what mentor you wanna be. So it kind of builds your personality. And so the way here that I see it, I really like welcome feedback and always like talk with the staff, asking them questions and having their expertise about that, because definitely they are more experienced and have faced more cases. And then the resident asking me questions, I really love. And even if they don't ask me questions, sometimes I just like come and say, oh yeah, I have like great cases. Do you wanna come and join? Because I really feel like, and that's part of medicine, I guess. It's really like kind of a companionship that you've been given some knowledge by someone, and you have to pass on this knowledge. And it's really rewarding to be able to just give what you've been given to the others.
Absolutely.
And so I really, for me, it's not like, I know that some people are like, oh, I have like to take kind of on from my personal time to just like see with the medical students, the residents. But for me, it's really part of what I love doing, and that's why also I love university hospital, because you get to have the medical student, resident, visitors, and I really love to share. Back in France, I was a tutor in biostatistics. Then I gave lectures about radiology lectures to medical students to prepare their residency exam. So it's something that I really love doing, and so I really appreciate that.
That's amazing. I think what you point out is incredible. So, although we consider fellows and residents as a part of the team, there's often an unsaid perceived hierarchy. So, a lot of times I find that residents hesitate sometimes to come and ask us questions. The same goes with fellows. The same also goes for like junior staff to senior staff. But that dialogue is what actually helps us all to become better. And one of the things which I realized on my very first day as a staff, because I was feeling very intimidated, because in my first day, I feel like I had a chip on my shoulder. I had to prove people I was right. Dr. Tony Hanbridge is one of the most senior most staff. He called me and he's like, hey, Satish, have a look at this case. What do you think? I mean, he obviously knows what it is, but it was his way of reaching out.
Yeah.
And it's great that you're doing it as a fellow to your residents, reaching out to them, telling them, hey, I have interesting cases. I'm going to show it to you. And then encouraging them to ask questions. That's the perfect way to build a team. And I clearly understand why we loved you so much, so that we want to have you on as a staff in the near future. But that said, all of this does take time. All of this does take extra energy. Like, it's at the end of the day, if you want to be an expert radiologist alone, it's a little bit easy. You just are the best at looking at images and providing a diagnosis. But what you want to be is go beyond that. You want to do more research. You want to be a leader. You want to be a tutor. You want to be a part of the team. You want to make not only yourselves better, but everybody around you better, and thereby impact patient care in a bigger way. And all of that takes time and energy. And as a fellow, you're working, you're doing call, and it gets really cramped up your time. So how do you handle all these time commitments? How do you make sure you take care of yourself as well, and you get to have fun and enjoy this fellowship here as well?
Yeah, well, that's a great question because, as you said, I think you have to have like this kind of work-life balance and also enjoy your fellowship because you're here only for 1 year. So you don't want to miss some great experience, just like go travel. So enjoy. So for me, I really think that when you are at work, you really have like just to deal with work. And then after that, extra when you're off on the weekend, even if you have like maybe some runs to prepare, etc. You have like what you want to do. If you want to go to a concert, if you want to just go for a walk, and just, or even just like, lay on the sun, just on the lake. I guess it takes priorities on the weekend. So you're not like always kind of frustrating saying, oh, I'm kind of, always dedicated to work and I'm missing part of the things that I would love to do. And to be honest, I've always, I guess, when kissing is try to be as much as organized as possible, and by doing so, you end up having this good work-life balance. And I personally, I don't feel that I'm missing out so much, even if I have yet to work sometimes a little bit on the weekend. For example, next weekend we just came to realize. And it was a deadline for some abstract submissions, so it was like we had to work. But it always comes in waves. There are some times where you have like nothing to do and you just enjoy, and you have some times that you have to work a little bit more, and then it's all kind of balance, and you everything turned out fine. But I guess really the main thing is to just enjoy fellowship and not. You want to be the best at what you do, but also you have to enjoy this opportunity of being here in Toronto and just exploring outside. So it's something that I think I think if you have this work-life balance, you're better at what you do, in the sense that you just come to work without being frustrated, without pressure, and in the end, it's better for the patient if you have this balance.
Oh, okay, that's a good way to put it. A happy radiologist is the best radiologist, I guess. So you're now in Toronto, but you've lived in Amsterdam. You've been in Netherlands. I mean, you've been in Amsterdam. You've been in France. You've been in LA. How does Toronto compare to all these cities?
Well, Toronto's really the things that I really love in Toronto is this diversity and the fact that you really feel quickly welcome, like part of the team. They really welcome you well, and really quickly I felt really part of the team. And even, for example, if France is my home country and I did one fellowship there, I felt like more part of the team when I joined here as a fellow, and even with even with the staff, sometimes you say, yeah, you have this kind of hierarchy. Well, here I don't really feel it, and I really feel like everyone has a voice, and every voice counts. It's more like democratic in a way, I would say, and it's really something that I really love. And Toronto, in that sense, is really great. The diversity of people, I guess that's the main thing that differentiate from the other place that I've been.
Yeah, that's one thing which has been so unique about Toronto. Like yourself, I've been in a few cities, but I've never felt at home more than in Toronto. When I came to Toronto, I was actually intimidated. I was actually a little bit apprehensive and anxious. But I joined here within a week. I completely feel at home, not just in the work environment, but just in the city itself. And it's such an amazing city.
Yeah.
So Farah, like, you've navigated a lot of these changes and transitions. You've done fellowships in France and here. So what are the advice you'd like to give for residents who are going into their fellowships? One, in terms of which fellowship to choose or how to choose the right fellowship for them. And secondly, in terms of how to make the best use of their fellowship year. Because I did 3 years of fellowship, and only after 1 or 2 years, I realized, oh, these are things you should be doing. And then I adjusted to the third year and, utilized everything the fellowship had to offer. But a lot of people just do one fellowships. So what are some of the do's and don'ts or the survival kit advice you'd like to give for aspiring fellows?
Well, as how to choose, I guess, the perfect fellowship, it has to be something that you really want to do and not like doing it just because, it's good like on the paper to have a fellowship. I guess you really have to do it because you have a purpose behind, because you want to get more specialized, because you want to maybe join a team. You have like aspiration in a future career. So I guess it has to match what your aspirations are, your personality in a place that you know that you would feel comfortable, welcome, not feeling homesick or just like regretting your choice. And I guess that's how you have to consider and choose your fellowship in the specialties that you want. If you want to explore different specialties, and you can do several fellowship, and then as a like survival kit or like advices that I would give, I would say maybe just to don't stress out beforehand, don't put yourself under pressure, and just enjoy like every moment of your fellowship. Feel free to ask every question. I've always said, and maybe people would say, yeah, maybe you're asking stupid question, but I personally think that there's no stupid question, and like people who ask questions it's better to ask questions than just like keeping this question and never knowing the answer. So just make the most of your fellowship by asking those questions, learning from the different persons, and just enjoy every minute of this fellowship, because like really time flies, and it will just goes by quickly, and you will not notice that it's already the end of the fellowship. Yeah, so just enjoy.
That is absolutely an amazing answer, because some of the best years of my life were my fellowship years. It's not as intensive and nerve-wracking as residency. It's not as laborious, filled with a lot of responsibility like a staff.
Right.
You're in that sweet in-between period, which is some of your best years of your life. So for those who are watching, fellowships are some of the best years of your life. So make sure you make the best out of it. A fellowship is sacred. It's almost like a rite of passage. But a fellowship in radiology is a little bit like the Fellowship of the Rings from the Lord of the Rings. It's a group of adventurers setting out to create an amazing adventure for themselves. Yes, it has perils, it is filled with challenges, but you learn in this journey more than just radiology. You learn about friendship, you learn about bonds which unite you. You learn about a lot more about life than just radiology. And that is why University of Toronto is one of the best places to do a fellowship. And if that doesn't convince you, you might have often heard the expression, any time when somebody is doing well, you'd be like, for he's a jolly good fellow, for he's a jolly good fellow. Or it also applies for women. It's commonly said, for she's a jolly good fellow, for she's a jolly good fellow. So if you think you're a jolly good fellow, but you want to be the best fellow, then come to Toronto and we'll make sure that you're the best fellow. Ladies and gentlemen, that was Dr. Farah Cadour, fellow in cardiothoracic imaging and soon to be staff in cardiothoracic imaging, and me, your host, Satish Krishna. See you in the next one. You were listening to Radiologists, a podcast by University Medical Imaging Toronto, the largest medical imaging group in Canada. Produced by Ina Levchuk. Learn more about us at universitymedicalimagingtoronto.ca and follow us on social media at Imaging Toronto.